about a large and important topic concerned in the theory as well as a practical point of view, that is the liver. The liver it's a major organ which we'll be discussing in the discussion. So in the practical exam point of view also, liver is very important. The liver is the largest gland of the body and consisting of both exocrine and endocrine parts. Exocrine part secretes bile, whereas the endocrine part liberates some useful chemical substances such as glucose from the glycogen and most of the plasma proteins and heparin directly into the bloodstream. So this topic we are going to deal under these following headings: introduction, factors keeping the liver in position, characteristic features of liver, external features of liver, presenting parts, ligaments of the liver and the lobes, nutrition of the liver, lymphatic drainage and applied aspects. So the liver is such a big topic and we cannot deal within 1 hour. So we can split this into 2 equal halves. So right now today's class we are going to deal with introduction, factors keeping the liver in position, characteristic features, external features and presenting parts of the liver. So remaining all the following headings we will be dealing in the next class. So coming to the introduction to the liver, so I think no need to specify the points once again because you have been reading about the liver from the school days onwards. So as usual, the liver is a internal body organ, is the largest internal body organ and we can call it as largest gland also. And it's a part, like if you compare, the skin is one of the largest organ in the human body. So next to the skin, the liver is another organ, largest organ. So it weighs approximately 1.5 kgs and the exact location of the liver it is found in the upper abdominal cavity extending from the right upper quadrant to the left upper quadrant of the abdomen. So it is also supported by some ligaments and which makes the liver to keep in the position. So it is attaching to the diaphragm by the falciform, coronary, left and right triangular ligaments. So this diagram will explain about the location of the liver in situ relations. So before going to that, we should know how the anterior abdominal wall is dividing into 9 quadrants. The anterior abdominal wall, by the passage of 4 different lines, it divides into the 9 quadrants. So there are 2 horizontal lines, there are 2 vertical lines. The vertical lines we can call it as right lateral plane and left lateral plane. The 2 horizontal lines are nothing but transpyloric plane and transabdominal plane. So in this image, you can see the right lateral plane and the left lateral plane. And we can see the transpyloric plane and transtubercular plane. So because of these 4 lines, the complete anterior abdominal wall is dividing into 9 quadrants. 1, 2, 3, 4, 5, 6, 7, 8, 9. So what are the names of that 9 quadrants? Right hypochondrial region, epigastric region, left hypochondrial region and umbilical region on either side of the umbilical region, right lumbar region, left lumbar region. And just below the umbilicus we have the hypogastric region. Right side we can call it as right inguinal region, left side we can call it as left inguinal region. So what is the importance of this 9 quadrants means? If you want to locate for surface marking for the surgical incisions, these 9 quadrants plays a major role. So to let you know the position of a particular organ in the abdominal cavity, they will describe into the particular quadrants. So now in this class we are talking about the liver. So we should know where is the location of the liver in the 9 quadrants. So as usual, it's a basic knowledge that the liver lies on the right side. So we should start from the right hypochondrial region followed by the middle portion called as the epigastric region and a small amount will be going towards the left hypochondrial region. And if you identify on the right side, a little portion may be extending into the right lumbar region, but the extension is very minimal. So majority of the cases, the majority part of the liver extends into the right hypochondrial region and epigastric regions. So now we are into the size, shape and color of the liver. So we know that the liver is a wedge shaped organ. It appears brown in color and the weight of this is ranges from 1.2 to 1.8 kgs in adults. So the weight may be varies in the case of the male as well as the female. In the case of the female, it is extending in between the 1.2 to 1.4 kgs, whereas in the case of the male, it extends in between the 1.4 to 1.8 kgs. So because these numbers are not constant always in the all books, so better to maintain the range from lower limit to the higher limit. So that will help you to give the proper answers in the MCQs. So at the time of birth, in the newborn children, the weight of the liver is 150 grams and it occupies 2/5 of the abdomen. So if you consider the divide the abdomen into 5 different parts, 2 parts of the abdomen is occupied by the liver. So the reason behind that is it helps in the hemopoietic function in the fetal life. So it has the major work. So the size should be very large in the case of the newly born children. And we should have a doubt that, so though it is 1.5 kg weight of organ, how it is maintained stably in the abdomen. So the reason and the explanation for this is, we should know what are the factors to maintain the liver in the position. So number 1, hepatic veins opening into the inferior vena cava. So all the small veins will be opening into the inferior vena cava. So within the parenchyma of the liver, the veins are in contact with the inferior vena cava. And intra-abdominal pressure and ligaments of the liver. So these three are the very important key points which keeps the liver in particular position in the abdominal cavity. So next, characteristic features. So that means they have unique characters. So that if you compare the same characters with the other, these will be having the more important things, the peculiar characteristics of the liver. The liver is highly vascular. It has lot of blood supply. The reason is the detoxification process will take place in the liver. So all the blood from the body, it has to come to the liver for the purification and moves with the respiration. So we know that lungs, intercostal muscles, diaphragm will move in the respiration. In addition to that, the liver also moves during the process of respiration and it appears reddish brown in color, essential to the life. So the essential to the life, because the majority, we can compare this as like a factory. So detoxification factory, if it is not working, the toxins will circulate throughout the blood. So it appears very soft solid and friable to the touch. So if you touch hardly, the liver will become pieces. So it is very friable to the touch. And the last and important point is regeneration capacity. So the liver has the great regeneration capacity. Even if you remove the 2/3 part of the liver, again the liver is having such a great character that it will regenerate. The main reason behind that is the cells of the liver, it has the capacity to undergo further mitosis very frequently. So if you cut the only 1/3 of the liver is available in the human body also, automatically the cells have capacity to regenerate once again. So this is a main reason why nowadays the liver donations are more commonly seen and without damage to the donor. So this anatomical position. So we should know, under in situ we know already we have seen, but in the case of practical point of view, in the dissection hall if they have given an organ in the exam, so we should know the anatomical position, how to keep it. So here you can see the two images. One image which is representing the anterior portion, other image representing the posterior part. So we should keep the liver in this way. So the soft and smooth surface should be facing anteriorly, whereas the impression area should be facing posteriorly. So along with that, another easy way, we can see the gallbladder and inferior vena cava on the posterior aspect. So The soft and smooth portion should be anteriorly, and impressive visual area should be on the posterior, and we should always keep the specimen in the right side because in situ relations the liver is located on the right side of the abdominal cavity. So coming to the presenting parts of the liver. So the liver is consisting of, I think you are aware of organs you have seen, lung, heart in the thoracic region. So any organ, it will be having some presenting parts. So here the liver is also consisting of surfaces, borders, lobes and fissures. So this among these surfaces, borders, lobes and fissures, this class we are going to deal with surfaces and as well as the borders. Fissures and lobes, remaining topics we will be discussing in the next class. So coming to the surfaces, the liver is consisting of a parietal surface, a visual surface. And the borders, it has the postero-superior border, postero-inferior border and sharp inferior border. So now this image we are going to talk about the borders of the liver. So as I said previously, this is the anterior portion, this is a posterior one. So here we can see an upper border. So this is called as a postero-superior border of the liver. Postero-superior border of the liver. So it separates the anterior from the posterior border surfaces. Anterior surface from the posterior surface. Whereas if you see, so this line is nothing but postero-inferior border. Postero-inferior border. So this postero-inferior border is separating the posterior surface from the visual surface or inferior surface we can call it as. And if you see here in downwards from left side to the right side, we can see a sharp border called as a inferior border of the liver. So overall the liver is consisting of three borders: postero-superior border, postero-inferior border and sharp inferior border. So once again I am showing the postero-superior border, and this is called the postero-inferior border of the liver, and this is called the sharp anterior border. So if you want to see the same sharp anterior border in the anterior view, so this will be the sharp anterior border. So now we are into the parietal surfaces. So I said previously it's consisting of two surfaces: parietal surface, visual surface. The parietal surface is nothing but here it is covered with the peritoneum, whereas the visual surface it is in relation with organs of the abdomen. So parietal surface again it is consisting of dividing into 5 different surfaces: superior surface, anterior surface, posterior surface, right lateral surface and inferior surface. So this image we can see this is a freshly removed human liver. So you can see here we can see the covering of peritoneum, and you can see the wedge shape of the liver, and you can see the superior border as well as the inferior border very clearly. So this image is a clue for us to understand the different surfaces. So if you view the liver from the upper part, superiorly if you view, so this surface is nothing but the superior surface of the liver. If you see anteriorly in the anatomical position, you can see the anterior surface, superior surface and the right lateral surface. And this is the posterior surface, and this will become the inferior surface of the liver. So anyways, I'll explain once again each surface wise. Yeah. So now we are into the anterior surface of the liver. So this is a normal image, Gray's anatomy image, which will be useful to you to understand this. So the anterior surface, if you see the anterior surface, it is triangular in outline and subdivided into anatomically right and left lobes. You can see this is the right lobe and as well as the left lobe by the attachment of falciform ligament. You can see here nicely the falciform ligament. The anterior surface is consisting of broad right part and narrow left part and intermediate triangular area. So this is the intermediate triangular area, and this is a posterior view, the same section. So now we are coming back to the superior view. So now we are talking, previously we came across anteriorly how the liver appears, how it appears on the posterior surface. Now we are dealing with superior surface of the liver. The superior surface of the liver, it is convex on the right and left sides. So you can see here this is a superior surface and you can see it is convex and concave in the middle. So on either side, right end and left end, it is convex. In the middle, it is concave. The superior surface is covered with peritoneum except a small area, which we can call it as cardiac impression. Then this is called as a bare area of the liver. Bare area of liver. So if you see the relations, so this is the in situ relations in the human body, how the liver appears. Here you can see the diaphragm, this one, and you can see the lung as well as the pleura. So this superior surface is in relation with right lung, right pleura, diaphragm, and if you see in the left part, you can see this is separated via the diaphragm from the pericardium of the heart. So coming to the right lateral surface. So here they have all these pinned structures are nothing but the peritoneum they have separated from the substance of the liver. It is convex. So this is the right lateral surface. So from here to here is nothing but the lateral surface. So it is convex on all sides and covered with peritoneum. So here they have removed diaphragm and peritoneum you can see very clearly covering on the liver. So relations, if you come to the relations, the under surface of the right part of the diaphragm. So this complete anterior surface, right lateral surface lies below the diaphragm. And the next image will help you to understand that. So this is a right lateral surface. It is convex all sides and it is lies below the diaphragm, below the right dome of the diaphragm. And you can see it extending from the 7th rib to the 11th rib. So from 7th rib to the 11th rib, this is the extension of the right lateral surface of the liver. And if you see the relations on this part, it is varies from the upper 1/3, middle 1/3 and lower 1/3. In the upper 1/3, it is related with right lung and right pleural cavity. So you can see here right lung and right pleural cavity. Whereas in the middle portion, it is related with costodiaphragmatic recess. In the lower part, the ribs are directly in relation with the diaphragm. After that, you can see directly the liver. So, the relations on the right lateral side, it is varies from the upper part, middle part and lower part. And if you see on the anterior surface, so this will become the anterior surface and this will become the superior surface. So clinical anatomy concerned with right lateral surface. So normally to extract the liver substance, we can call it as liver biopsy. So normally the using space is either the 9th intercostal space or 10th intercostal space. So the procedure will follow during the forced expiration. So that will avoid damages to the lung and pleural cavities. The needle will be directly enters into the substance of the liver. So this is an anterior surface. As I have explained about this one. So this is anterior surface, and you imagine that the costal margins will be coming like this. Okay. And coming into the relations of the anterior surface. So on the right part, it lies beneath the right costal margin. So this is the right part, right below the costal margin. It lies on the below the right costal margin and related with diaphragm 6th to the 10th ribs of the right side. So you can see the number is given very clearly. 6th to the 10th ribs they have located. On the lower margin of the right lung and as well as a pleura. So for that confirmation, you can see this is the anterior surface of the liver and you can see how the costal margin is extending and you can see the number 6 to 10 is also extending. You can see the pleural cavity along with the lung, how they are relation with this one. On the left part, it lies at the left costal margin and related with the diaphragm. You can see this is a left side of the anterior surface. So you can see this is episternum and the left costal margin and diaphragm you can see. And it is extending in between the 7 to 8 ribs. 7 to 8 ribs. So coming back to the posterior surface, the posterior surface, it intervenes in between the postero-superior and as well as the postero-inferior border. So this is a postero-superior border, this is a postero-inferior border. In the middle, the posterior surface is deeply concave for the enlargement of the vertebral column and the right side of the vertebral groove. So right side of the vertebral groove. And on the right side of the vertebral groove, the surface is broadly convex, which occupies the right paravertebral gutter. So, what are the common things you'll observe in the posterior surface? So, we'll see the first, the bare area of the liver. We can see the first, the bare area of the liver. So, this green color mentioning white representation is nothing but the bare area of the liver. And here it is the largest non-peritoneal area on the posterior surface of the right lobe, where the liver cells are covered with fibrous Glissen's capsule, that is nothing but the connective tissue capsule of the liver. The bare area is triangular in shape, so you can see here the triangular in outline, consisting of an apex, base, upper border, lower border. Apex is by the coronary or inferior triangular ligament. Apex is right triangular ligament. The base is groove for the inferior vena cava. So this is a base. And upper limit and lower limit are formed by the coronary ligaments. Upper limit and lower limits are formed by the coronary ligaments. And the next prominent feature is groove for the inferior vena cava. So it is also the non-peritoneal vertical groove. And its floor is pierced by the hepatic veins. The floor is pierced by the hepatic veins. The hepatic veins are divided of walls and arranged into the two groups, upper group and as well as the lower groups. So this is a groove for the inferior vena cava. So now we are talking the impressions which will be seen are relations seen in the posterior surface from right side to the left side. So first we are talking about the bare area of the liver. Second one is groove for the inferior vena cava. So you can see here this is a groove for the inferior vena cava. And the third one is caudate lobe. So we can call it as a comma shaped lobe. It is bounded on right side by the inferior vena cava, groove on the left side by the fissure for the ligamentum venosum, above by the posterior border and below by the porta hepatis. So this is a caudate lobe. And coming into the fissure for the ligamentum venosum. So this is a fissure for the ligamentum venosum. And next one you can see this is a groove for the esophagus. Groove for the esophagus. So once again I repeat the structures from right side to the left side. Posteriorly, bare area of liver, groove for the inferior vena cava, caudate lobe and as well as ligamentum hepaticus and last one is groove for the esophagus. So these are the things from right side to the left side on the posterior surface. So now we are into the inferior or visceral surface. The inferior surface is directed downwards, backwards and to the left. So this is the inferior surface directed downwards, backwards into the left. It is separated from the anterior and right lateral surfaces by a sharp inferior border. So this is the inferior border which is separating from the anterior and as well as a right surfaces by a sharp border called as a inferior border. Most of the inferior surface is covered with the peritoneum. So this complete surface is covered with the peritoneum except the three areas. Number one, fissure for the ligamentum teres and fossa for the gallbladder and porta hepatis. So from right side to left side we can say fossa for the gallbladder, porta hepatis and groove for the ligamentum teres. So except these areas, remaining all areas it is covered with the peritoneum. So what are the features we will observe in the inferior surface? So we will observe the gastric impression. So it's very easy that in the posterior surface we will observe the esophageal impression. Just below that we can see the gastric impression. And tuberomental. The tuberomental is nothing but it's a tuber like elevation, a round elevation between the gastric impression and as well as the lower end of the fissure for the ligamentum teres. So this is a ligamentum venosum. From ligamentum venosum to the gastric impression, you can see an oval shaped impression called as a tuberomental. And fissure for the ligamentum teres and the quadrate lobe. So the quadrate lobe, the name itself gives that it's a quadrangular in shape, bounded left by the ligamentum teres, right side by the fossa for the gallbladder, and inferiorly by the sharp inferior border, and above by the porta hepatis. So this concerned lobe we can call it as quadrate lobe of the liver. And coming to the porta hepatis. So the porta hepatis is nothing but it is a transverse non-peritoneal fissure and acts like a gateway of the liver. It extends from the neck of the gallbladder to the fissure of the ligamentum teres. So this is the fissure for the ligamentum teres, neck of the gallbladder. So it is extending in between them and intervenes in between the quadrate lobe front and caudate lobe. So this is the caudate lobe and quadrate lobe. So it lies in between the ligamentum teres, ligamentum hepaticus and neck of the gallbladder, caudate lobe and as well as the quadrate lobe. So the lips of the porta hepatis gives attachment to the anterior and posterior layers of the lesser omentum. So I think this is the same thing you have revised in the lesser sac and the greater sac attachments also. You might have gone through this one. And next coming to the caudate process. So here in relation with the caudate lobe of the liver, and an extension will be seen towards the right lobe of the liver. So this is called as a caudate and papillary process or caudate process of the liver. It is a tile-like projection. You can see it is a tile-like projection which arises from the junction of the lower end and right margins of the caudate lobe. Lower end and right margin of the caudate lobe, a tile-like extension. So this is very important. It forms the roof of the epiploic foramen. What is epiploic foramen? Communication between the greater sac to the lesser sac. Next thing is papillary process. It's a conical projection which arises from junction between the lower and left margins of the caudate lobe. So this is the papillary process. You can see the extension. And coming back to the inferior surface. So the inferior surface, this is also another diagram which explains about the remaining. So in the previous diagram you came across all the peritoneal, all those things. So here the remaining impressions you will see very beautifully. So this is the gastric impression and this is for the esophageal impression, and here you can see the colic impression. Along with that we will see the renal impression, and this is the quadrate lobe, fossa for the gallbladder. So if you trace once again the extensions, that means the impression seen from the left side to the right side, gastric impression followed by the quadrate lobe, and you can see the colon impression here and tuberomental here, ligamentum teres, quadrate lobe, fossa for the gallbladder, and finally here the colic impression. Above that you will see the right kidney impression. Above that you will see the right suprarenal impression. So these are the normal impressions which we will observe very clearly during the dissection time also.